Never see it. Okay. Okay. So we're going to go through how I set it up is half the table is going to be your med room, half of the table is going to be your patient room. So you understand that's going to be the setup of the day of SPD. So this will be our setup, and I'll have it look exactly like this. So you'll go right down the list. You're going to tell me, I'm going to hand you this, and this is your MAR. Okay? So your MAR will be here, and you'll tell me, okay, we have, let's use a different one than we just used. Here's one, and you'll say, okay, the patient that I'm going to give the medication to is Mr. Davis, and he is going to get Lasix 20 milligrams IV push now. And so that's going to take care of verifying the patient's identity with 2 identifiers while we're here. Now, that's going to happen at the bedside as well, okay? But you're going to tell me that you know it's for Mr. Davis, and that's what we're going to do. We're going to verify the physician's orders. You're going to tell me that the rights of the patients. Again, write down this list, guys. So patient, medication, dose, time, and the route. Then you're going to look at your medications. You're going to find Lasix on the table. Let's see. So we've got Lasix here on the table, and you're going to say, I have Lasix, and it's 40 milligrams. And you're going to tell me that. So you're going to say, okay, and the expiration date. And most all of them are going to be expired. And you'll tell me it expired in 2012. That's okay, we're going to pretend it's 2014, okay? You're going to verbalize that my patient has an allergy to penicillin. So if your patient was, you were administering a drug that had penicillin component, you would want to be able to identify that, okay? We know right now that Lasix doesn't have anything to do with penicillin, so we're okay. Verify and verbalize compatibility. Now, I will either have it set up the way it is here, where you are already connected to a line, an existing line, or I may have it just saline locked for you, but that will be the only 2 ways you'll see it, either hooked up completely or in a saline lock form. Now, it's going to be your job, if you have it hooked up to an IV bag, at that point, you're going to be able to confirm whether or not Lasix is compatible with what I have hanging. And that's when you would stop and you would look and you say, okay, and I may have LR up there. I just put a little tab that said LR. I may have normal saline. It could be anything, and I'll just put a little sticker that'll let you know what kind of fluid you have running for your patient. And that way you can confirm whether or not that medication is compatible with what you have hanging. If it is not compatible, you will say, this is not compatible with this medication. And then that's at that point, we know we're going to come down on our form. We're going to finish this, and then you're going to come back to the incompatibility section. Is that clear? So we want to make sure you're going to let me know that, let's say this one is compatible. You're going to prepare your medication, so you'll be drawing up. You have everything, every size syringe. It's going to be your choice to decide which one you use. Again, I don't recommend that if you're giving 2 milligrams that you use a 10 ml syringe unless you're giving something like Dilaudid, and you're going to need to dilute that, okay? So pay attention to how you're going to draw that up and what size syringe that you would use. There's going to be needles here that you're going to use to draw it up. So you'll get to remember there's not, just because it looks like this is sterile water, it's not normal saline. So pay attention to what's on the table, okay? It could be different types of fluid up here. And if you need it, like Protonics, needs to be mixed with normal saline. So if you pick up sterile water and use it, that's not what we need. We need normal saline, okay? So you will prepare the medication correctly. By cleaning it, drawing up the right amount. You're going to do your dosage calculation here. You're going to make sure that it's right. Solumedrol. I have 2 different Solumedrols on the table for you. One of them is 40 milligrams, and one of them is 125 milligrams. So you need to pay attention to the dosage that you have. I may give you one that says you need to give 80 milligrams. Well, you only have 140, so you've got to take it from the 125 vial. Does that make sense? You'll do the drug calculation, and you can get that. You're going to apply clean gloves. Of course, we're washing our hands. You want to make sure you have 2 of your normal saline vials. And then once you've drawn up your medication, you're gonna label it, so we know what we've got. Because a lot of times, if you mix something in a 10 cc syringe or 10 ml syringe, once you grab your tube, we don't know which is which at this point because they're all clear. So just make sure that when you're done drawing up your medication, that you use, you go ahead and you label that. When you get to the patient, it says in the next step to assess and verify patency. So this is when you would tell me I'm ready to go. You've got your alcohol, you've got your medication, you've got your 2 syringes, and everything is labeled. We're ready to go to the room, and you just confirm to me that you're ready to go to the room. So then we come to the patient's room, and this is where we're going to do our double identifiers. We're going to confirm that the order that we have is truly the patient that we have, and we're going to confirm the allergies again. And then that's when we can verify patency of the IV. If you have an existing line, remember, just because it's going at 20 does not mean that that IV is patent. You need to go ahead and flush, okay, and make sure. So we'll bring we have this here. You're going to, we're already on an existing line, you're going to stop your pump. So we come down, let's go down to existing line, and we'll say that it's compatible. So we select the injection port closest to the patient. We have it here. We're going to clean this port with our alcohol that we brought into the room. And then we're going to make sure that that the IV is patent. Okay, now how can we do this? We've stopped our pump. We're going to take this out. Now when I say flush to see if something is patent, I don't mean that we push it like this. Because are we really going to see anything happen? It's probably going into the interstitial fluid, and we're not. But if you push like this, we're going to see that welt come up underneath the skin, and you can kind of do like this. And you're like, oh, I'm not sure. We may have to flush again. We want to make sure that that IV catheter is still in the vein. And they could have went to a procedure, and you know how easily it is that it can come out. So just because it has something going doesn't mean. So we're going to flush and make sure that it's working. Once we've verified patency and that it's working, we can clean it again, hook up our medication to our existing line. We flushed with 10. Let me make sure I'm doing the right one here. Existing line, compatible. So clean the injection ports, occlude the tubing. Do you see how I've occluded that tubing? Because we don't want it to flow back into the bag. So we have to occlude the tubing, and this is exactly how I hold it usually, or something to this effect. Just as long as I'm making sure. We've already got this. Now this thing by this point, because we're kind of slow, is already beeping, at us, and it's hollering. And I'll just come over and I'll silence it for you guys. So I'll be standing there watching you and helping you out, because again, we want our patients to be confident in our abilities. Okay, so I'll be kind of helping you through. So then once we've occluded that, we're going to put our medication, whatever we've drawn up, we're going to give it at whatever rate we decide. Now Lasix, does anybody know how fast we can give Lasix? Those are the things that while we're still in the med room, you'll be telling me. I know that I can give this medication over X amount of time, and I don't need, it can be given undiluted. And we know Lasix is given undiluted. So you would tell me that before we came in. And I'd say, okay, well, if you're going to give it over 5 minutes, and you have right now in your syringe, how much do you have? So you're going to have to tell me what you're going to do. For instance, if this one, I think it was 2 milligrams of Lasix that we had to give. No, 40 milligrams. It's 10 milligrams per ml. So how much is that? 4. So we know that we can give Lasix. Does nobody looked it up? Can we give it over 4 minutes? Yeah, we can. So wouldn't that be the easiest thing to tell me? Instead of saying, oh, okay, well, we can give Lasix over, pick a time that makes it very simple. I'm going to give 1 milligram per minute, Ms. Davis. That's all you have to say. And then I know that longer is better than saying, I'm going to give it over 1 minute. And then that's not enough time. Okay, make it easy. So you can give that here. We've given it. We clean our site again. Now we're going to flush with 2 to 3 mLs, just like it says here. Okay, we're good. We flushed. We're going to open this up. We're going to start it back. Any questions about that? Now that is within a compatible. If we're incompatible, you would go to that section of incompatibility where you would stop the fluid, select the port closest to the patient, flush the line with a full 10 cc's. That's the 10 mLs. That's the most important. So you're going to flush with 10 mLs before give your medication. Now this 10 mLs, does it have to be at a certain speed?
No, the first one, no.
Exactly. So you can give that fairly fast, right? In fact, I can check to see if my IV is patent with the first 10 mLs, right? Can't I do that and kind of save that step? So I'm going to make sure my IV is good at the same time I'm giving my 10 mLs, and I can give that at any speed. So that's what I do to save a step. Okay, I'm going to go ahead and flush with 10, and you verbalized to me, I'm going to flush with 10 mLs of fluid, and at the same time I'm going to check for, to make sure my IV is patent. You would give your medication, again, whatever time you told me, then you would give another, go ahead and put another 10 mLs, clean it, put another 10 mLs on there, and give that fully. Once you've done that, you open your line back up and you start your back. Any questions about that?
Are we pausing or turning off our pump?
You can pause it.
Just pause it. Okay.
Now, the other way you could get it is if you just have it in a saline lock situation where you're here. Okay, and the same thing kind of, we've got to verify placement. Again, all of our identifiers, everything we did before, but with a saline lock, you would just clean the port, inject the medication. Again, we're making sure that we have a patent IV first. Okay, that's part of that top part. We want to make sure every time. We do our flush, we make sure we've got a good line. We give our medication at whatever speed it is that we need to give it. Then we want to flush. This is where you guys mess up. Flush at the same speed. Okay? Don't give your morphine beautifully and then you flush and you just hit it as fast as you can. It's happened at the bedside with a patient.
Wouldn't that push all the drugs in that are left in the line too fast?
Right. That's why you have to do it at the same speed as your medication, because that's when the patient feels that euphoric feeling if you're given like a morphine type dose. And with a little old lady who's 90 years old, you've just put her in respiratory compromise potentially. Luckily, when the student made this mistake with me, it ended up where the patient was a 350-pound guy who had been taking the same amount for multiple days. So it was okay. You know, he was okay with that. But luckily for the student. Okay. So then when you finish that, you flush at the same rate. And then one important thing I want to show you guys, and I know you should know this already, and you probably already do, but we have our saline light and we're pushing, right? And this is just with our saline light. We're pushing it, and as we're pushing it, we're going to clamp. Okay? Does that make sense? We don't disconnect and then clamp. While we're pushing that last 2 to 3 at the same rate, we're clamping. Okay? Any questions about that?